My name is Kristen, and if there's one thing you know about me, it's that I love to travel. My boyfriend, who's my now husband, is my travel companion, and we've gone everywhere. Even though I was traveling around the world, I had no idea I was at risk for TB. And I came home, and over time, about the course of 8 months, I started to develop a little bit of a cough. And that cough eventually turned into coughing up a little bit of blood, and that's when people started to pay attention. So they did a panel and looked for TB, and sure enough, I had TB.
Walking to my doctor's appointment.
One of the more fun ways that I was able to stay sane through the process was documenting my journey on Snapchat and Instagram.
Like a champ.
We found out that my husband had LTBI. LTBI, that's the latent TB infection.
I have got a potentially deadly disease that is in my body. It fortunately has not, turned into its more deadly state yet. I don't have a lung infection that's, going to kill me, but that could happen, and it may very well happen at some point, over the rest of my lifetime unless I get treated. Why in the world would I not go through that treatment? And the treatment for LTBI is significantly less impactful on my life and on my body. It's still a lot of antibiotics. Gosh, I stopped myself from potentially developing a much, much, much more serious condition. So I'd be walking around with this infection and have no idea of it. I may have gotten it at the same time she got a latent infection, and mine just never turned into an active infection, or excuse me, an active TB situation, and hers did. The latent TB infection is treatable. Maybe luck of the draw, maybe I got it from her, who knows? I like to say I got it from her, but as I understand it, in many parts of the world, you've got thousands and thousands and thousands of people walking around with LTBI that, it's a little bit of a time bomb. They may or may not get sick at some point, and that may or may not proliferate the disease. In the United States, we, have the luxury of being able to get tested, being able to get treated for LTBI, and sort of stopping the spread of a disease in its tracks. And, in a very small way, I'm really proud to be a part of that and sort of help stop that spread.
Luckily today I'm healthy and happy and I cured it, but had I known about this disease, had I known that the places that I was traveling were TB hotspots, I would have come home and taken a test and caught it before it ever turned into anything bad.